Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The Zest Anchor System is one of the many types of attachment systems which provide retention and stability for full dentures utilizing non-vital teeth. The female component, machined of surgical stainless steel, is cemented into a prepared recess of the selected non-vital root. The male portion of the attachment is manufactured in nylon and retained in the denture. Subgingival contact between the male and female results in application of forces near the center of root support. The system is highly successful even with minimal bone support to the remaining dentition. Sound biochemical design, low cost, and minimum chair time make routine preservation of questionable teeth possible. Materials needed for the following sequence are a number 700 tapered Fisher burr, a 110 SP Starlight diamond burr, high-speed handpiece plus burr changer, low-speed handpiece with friction grip, a number 2 lead pencil. At this stage, the patient has come to a level of good periodontal health and endodontic treatment has been completed. The remaining teeth are now ready to be reduced and to accept the Zest Anchor attachments. The Zest Anchor requires complete reduction of non-vital teeth to the level of the gingiva. Either a number 700 or 1701L carbide burr or the Starlight 110 SP diamond burr may be used for gross tooth reduction. Pulpless teeth are much more brittle than vital teeth, and care must be taken to prevent a fracture of the root. By dividing the tooth into 9 segments, the reduction is accomplished in small increments, minimizing the stress to the tooth. Materials needed for the following sequence are number 35 inverted cone burr, number 700 tapered Fisher burr, number 6 round burr, Zest sizing burr, low-speed handpiece with friction grip, Zest female, and Zest male. Drill a pilot hole with either a number 700 or 1701L carbide burr to a depth of 4 millimeters. Exact parallelism is not required. However, when more than one attachment is used, make an effort to prepare the pilot holes and the final recess as parallel to one another as possible. Divergence of the female components will limit the degree of rotational freedom of the male anchors and could contribute to the wear of the male anchor. The preparation does not have to follow the canal. Caution must be used, however, to not perforate the root laterally. Enlarge the pilot hole with a number 6 round carbide burr to a depth of 3 millimeters. This initiates the preparation and lessens wear on the diamond sizing burr. Complete the recess with the special Zest diamond sizing burr. This burr should be used at low speed to a depth where a flat seat on the occlusal surface is created for firm seating of the metal female and for a proper seal. Keep the diamond burr rotating throughout this procedure, including removal of the instrument to prevent breakage of the tip. The recess for the female attachment is completed with an inverted cone burr, creating an undercut for cement retention. Utilizing the nylon male anchor as a handle, try on the metal female receptacle. An oversized preparation should be filled with composite resin filling material and re-prepared. Materials needed for the following sequence are Zest male component, Zest female component, composite resin filling material, a selection of finishing burrs, sandpaper discs and mandrel, slow-speed handpiece with latch head. Cement with composite filling material the metal female component in the prepared root recess. The nylon male anchor serves again as a handle. Be sure that the male is fully seated with the blue centering sleeve covering the female opening. This blue sleeve prevents the composite resin cementing medium from filling the metal attachment receptacle. After cementing the female portion with composite resin, finish the restoration from the metal flange to the tissue. Finishing burrs and sandpaper disc are used to smooth the root surface and filling material. The plastic male attachments are now ready to be secured to the denture. Through lingual openings in the denture, the Zest Anchor males will be visible. A paintbrush is used to add self-curing resin at the lingual windows. After the plastic male attachments have been luted to the denture, the blue centering sleeves are removed. The acrylic covering the remaining root surface is relieved so that there is no contact between the root and the acrylic saddle. The patient is instructed in the use and care of the overdenture prior to dismissal. Use of the overdenture allows the patient to retain teeth that are not entrenched in bone firmly enough to support a more conventional prosthesis. The life expectancy of these teeth is increased appreciably. Resorption of the residual ridge is retarded by retaining the root as a bone-maintaining organ, and the stability and retention of the denture are dramatically and immediately improved.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.